Happy Friday, everybody. Hey, I didn't forget this week. I think that was 2 weeks ago. I actually forgot. Last week we shared, I think I shared the, from the night, Raven's Talk. Yeah, okay. I'll get my head on straight, guys. Welcome to live Facebook. I'm coming in here today with some pretty exciting things. So we'll give everybody just a moment to hop on. We've got some updates, some announcements, and then I'm going to teach a little bit about what manual therapy is. So happy Friday. We have some save the dates. I think that's what we'll start with first while we wait for everybody to come in. If you guys join, please say hello. And if you happen to catch this later, just comment below replay. Comment replay below the video so that I know who's coming in here to watch it. We have some very exciting things to share with you all. First of all, some save the dates. So many of you know that last week on Thursday, we had our very first community event at Fit for Life. Now that we have this beautiful new space and a large room, we plan on filling it with monthly events to help you grow in knowledge and for us to be able to serve you in all various manners to help you be fit for life. So we were very pleased with the turnout that we had, and we're hoping that it will just continue to be a blessing and something that grows. So the next live event that we have on the schedule is Thursday, March 16th, and it will be the same time, about 7 to 8 o'clock, really. This is coming off of the heels of the talk that we did at Second Soul a few weeks ago, where one of the questions that those runners had was, what is dynamic stretching and how do we do it? Or what's the difference between dynamic and static? So Raven will be speaking again on Thursday, March 16th, and she's really going to do a basic discussion about stretching, why it's important. I know sometimes it's a bad word for people, but it is important to help you be healthy and to remain active. And there is a difference between dynamic stretching and static stretching, and a time and a place for both. And so she will be sharing on all things dynamic stretching that night. So be on the lookout for a sign up, just like we had last time, and for an invitation, and we hope to see you guys there. Please bring a friend. The more the merrier. So that's the next community event. We are working on a schedule or calendar of even including some special guests that are going to be making some appearances to come and speak to all of us at Fit for Life over the course of the year. So very, very excited about what's to come there. Second important update or save the date for you all to remember it or be aware of is going to be a grand reopening open house and meet the team on Friday night, March 31st. It'll be like a happy hour from 5:30 to 7:30. We are looking to make this an epic event. We are very, very excited, first of all, to be in our new space and to be able to share that with all of you. And we have many, many exciting faces and things that we plan on presenting that night. So please mark your calendar to stop by on your way home from work on Friday night. We plan on having refreshments. We plan on inviting the whole neighborhood. We plan on supporting a local nonprofit, so please be on the lookout for more information on that. And we plan to have several giveaways that'll help us raise money for this nonprofit. So, and the other thing we plan on doing is introducing you to some new faces, which is part of the third announcement that we have. So my request to all of you is to please mark your calendars to come. we are looking for sponsors or people that just want to make donations or contributions to help make the event better. So if you or somebody that you know is willing or able or interested in making some kind of a donation, whether it's food, beverages, services that we can spotlight, highlight, or give away, or gift baskets, some nature, we would be happy to share that with people to help make the event epic. So if you are interested or able and want to do that to help make our event special, please send any one of us at Fit for Life a message, and we will gladly accept that. The other part of the event, I mean, obviously many of you guys in here know that Raven is our newest PT, and some of you have not met her, so it will be a meet and greet for Raven as well. But as we have been looking for ways to serve you and to fill our space, we have a few other individuals that we want to introduce and or highlight for you. Some of these people will be new to you at Fit for Life. Some of them have already had a quiet presence in the background. It's just that we now have a beautiful space to share them with you. So introducing, I have 3 very special people, healthcare professionals that are going to become more of a presence here at Fit for Life. The first woman's name is Joy Cimino, and she is a dear friend of mine. She is the creator of my logo, my website, our business cards, the Wellness Warrior shirts that we have. She's a creative genius. She's a beautiful soul. She's also a personal trainer. And for those of you that are part of our Wellness Warrior program, her services, her free consultation has been offered to you as a part of your membership. She will be present that night for the meet and greet, and we're looking forward to actually adding some resources at the clinic for her to be able to actually come in and work with those of you that are interested in a personal trainer at Fit for Life as well. So Joy will be there. The next person that I'd like to introduce to you that night is Alyson Dondorfer, and she will be a new face for many of you. Her and I have been friends for a very long time. She is also a physical therapist, but she is going to be joining forces with us at Fit for Life and using the gift of her knowledge as a certified functional health coach to help all of us truly, she calls it, live in optimal land, to be truly fit for life, to work on hormones and gut health and stress management and all kinds of valuable resources and knowledge, and super knowledgeable on supplements. So she is going to be hanging around the office a little bit. So if you are in when she is around, she'll be hanging around to say hi. And she will also be available that night for a meet and greet. The third person that we are sort of formally introducing again is Cherise Goodrich. She is not able to join us that night because it is, I think, the start of spring break, but we will have a station set aside for her. Cherise is also a very dear friend of mine who is a teacher at a local school district here, but also is her own certified functional health coach. And I think what you'll find is both her and Alyson offer different levels of knowledge and passion and expertise. And where Alyson may have a different medical perspective of helping people, Cherise is a teacher at heart, and she has a beautiful way of making things simple. And all 3 of the ladies that I've talked about have been invited to take part in some of the community events, the monthly Thursday night talks. So stay tuned for those dates, and I really look forward to all of them sharing what it is that they learn, they know with you guys. So Cherise also her services have been offered to those of you that are wellness warriors. So for those of you that have your pink folder and you got that when you joined your Wellness Warrior program, she has gifted you all with a free course that you have lifetime access to. I forget I think it's about like simple nutrition. But anyways, I look forward to you guys meeting her and putting a face with her name. And I really look forward to those three ladies sort of making a grand addition to our family at Fit for Life, which is growing. So that's it for the announcements. That part was lengthy, but what I'm going to do next is just talk for a few minutes about manual therapy. This is something that Raven spotlighted a bit on her social media presence on the weekend, and we thought it would be a good idea to just review it a little bit in here for you all. For those of you that have been a patient at Fit for Life Physical Therapy, you have been on the receiving end of manual therapy. It is just one of the tools that we use as physical therapists, but we truly believe that it is one of the tools that we use that sets us apart in terms of skill level and getting results for our patients. So what is it? It is a tool that involves the use of our hands with or without an additional tool. I'll explain that in a minute. Basically, and there are several different kinds of manual therapy. Manual therapy requires skilled evaluation and assessment from the therapist to know when to use it, to know where to use it, with what force to use it, and it is definitely something that should be, we believe, part of a well-rounded physical therapy treatment plan. There are many different types of manual therapy, and it ranges from massage, which many people are familiar with. I do like to say we are not massage therapists. They are way more skilled and artistic in their craft than we are. Some of the techniques we use are massage-like. Most often, the tools that we use fall in lines of soft tissue mobilization or manipulation. So actually using our hands to mobilize. Soft tissue just is your muscles, ligaments, connective tissue. It's not the bones, it's your soft tissue. Myofascial release, which is another version of manual therapy. If soft tissue mobilization or manipulation, I had a way to differentiate it, can be a little shorter of a interaction between the therapist and the muscle or soft tissue. Myofascial release tends to be this isn't a perfect analogy, but a more low load, long duration stretching. Myofascial release involves looking for an area that is restricted, putting pressure into the body and allowing time for that tissue to move or stretch or melt or whatever verbiage you'd like to use there. So that's a simple way to describe myofascial release. We also can use our hands to move your bones, to make changes to your bony anatomy. And most frequently we're doing that at the level of the joint, the place where the two bones come together. So just like soft tissue mobilization or manipulation, we do joint mobilization or manipulation. The difference between a mobilization and a manipulation is a mobilization stays within the constraints, the physiological constraints of the tissue, and a manipulation is a higher thrust force that can go outside of the normal physiological barriers. And we're not all trained in manipulation. So Raven, as a more recent graduate and a DPT, went to a very manually based college, and she is trained in manipulation. And I am not. So the manual mobilizations that I use, whether it's soft tissue or joint, is mobilization, stays within the constraints. So that's a little bit about the difference. Manual therapy can also include stretching, where the therapist assists in providing a low load, long duration stretch. And if we use a tool, which is what I was alluding to before, there are a few types of manual therapy that involves the use of a tool that is not our hands, because our hands themselves are considered the tool during manual therapy. The Graston technique, or instrument-assisted soft tissue mobilization, is a tool that both of us use. Raven is working on her, she's a provider, which means she's taking the Graston specific courses. And that is the use of the titanium tool, to use the tool in very skilled and technique trained ways to perform the manual therapy techniques. And then dry needling would be the last. And dry needling is, some of you may have had it, it's just the use of very small needles placed very specifically to interrupt the soft tissue integrity, the myofascial system, and to release the restrictions with a little bit of some outside help. Out of all of the things that I have just mentioned, dry needling is the one that we do not currently do at Fit for Life, but that we have a plan in place to be able to provide for you and bring to Fit for Life by the end of 2023, to at least begin to be able to provide that. And we, both Raven and myself, are very excited about that. So that is the what manual therapy is. Some of the benefits of manual therapy are promotes blood flow or circulation. It improves tissue alignment. It improves joint mechanics and alignment for those times where joints have become stuck. We call it hypomobile. It can reduce swelling, reduce pain. It helps restore normal movement. It is one of the tools that we use that promotes healing and restores normal movement and helps to get you on the track to healing more quickly than just exercise alone. And we very much firmly believe that it is one of the things that sets us apart at Fit for Life. So that is my talk for you this Friday afternoon. If anybody has specific questions about any of the things that we've talked about, please feel free to comment them below. If you are able to help us with our sponsorship or donations for our open house, please send us a message. And as always, we just want to say thank you for allowing us to serve you, to be your go-to provider for physical therapy when pain or injury strikes. And I hope everybody has a great weekend, and we will talk to you guys soon. Bye now.